Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Successful spondylolisthesis treatment. Live active and pain-free without surgery or pain meds. That's the title of our program today, and we have our expert here at my side.
Right.
Because Brad is living with it.
Right. Spondylolisthesis diagnosis, grade 2, diagnosed approximately 10 years ago. I know I had it longer than that, but that's when I had the x-rays taken to confirm it. Although I know when I was in my early 20s, I did not have it, and I think I know the accident I had that got it moving.
It was a water skiing accident.
Yeah, knee boarding.
Knee boarding, yeah.
Yeah, I jumped away, the knee went in, the board went into the water, which really hyperextended my back.
Oh, sure.
And it was a painful little accident.
Grade 2 is a fairly progressed
right. It's not a mild one, but it's not severe.
Right. Well, it's fairly severe, wouldn't you say?
Well, yeah, we'll get into it here. So, Bob, there's 2,700 people out there that are just waiting.
You got big numbers today.
Well, of course.
In case you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy and fit and pain-free, and we upload every day. Also, if you get a chance, get over to the Facebook and like us, because Brad and I, as children, we're not liked, and we are trying to turn things around.
Well, we were liked a little bit.
Well, maybe you were, and I wasn't. Nobody liked me.
I can believe that. Okay, spondylolisthesis. If you have been diagnosed with it and you hear this big name, and it may just completely scare you much more than it should. 5 to 10% of the population in the U.S. study shows have it to some degree. There are people who do not even know they have it, and they don't have symptoms. What happens is your vertebrae literally slip. And that's what the term means. If you break the term up, it's Greek. Spondylo means vertebra. Listhesis means slippage. So your vertebrae actually slip on each other, usually at S1 and L5 or L4 and L5. Mine are L4 and L5.
Gotcha.
So the whole thing is you want it to stabilize and avoid it from slipping any further in the future. And that's what I'm going to give you. So the primary objectives here are to live without pain, continue to be active, and avoid surgery at all
costs. Live your life.
Right.
And be able to do the things you want to do. You may have to modify things a little bit.
Right.
But you still can move on. Brad's a good example of this. Very active.
Right.
Still running.
And typically, you know, if you have a flare-up of this, or maybe you've had an accident like I did, which created it, this is something that is not going to cure within a week.
Right.
You can control the pain, but I mean, to get to the point where you're really active, if you happen to be an active person, it's going to take some time. How much time? I don't know. I can give you some idea on mine, but
you're very dedicated and very. I mean, you stuck with it as far as an exercise program and.
Right. I follow these simple rules that we're going to get to. So, common symptoms. If you have spondylolisthesis, it's very common for these people to say, if I'm standing in one spot for a long time, and it may be 5, 10, 20 minutes for sure, you start to have back pain. Oftentimes you get pain, numbness, tingling down one or both of the legs. Typically when you sit down, feels much better. Okay, so there's a little component of stenosis, but we just need to know the symptoms.
Sure.
Other thing, extension. Let's say you're washing or painting an overhead ceiling. Typically bothers the back. When you get into it I was doing a project once with my brother, working on drywall overhead. Just by the end of the day, I was just, even sitting down, it didn't feel so good.
It was so fired up.
Yeah. So extension, activities that go backwards, so you need to avoid that. So how are you going to stabilize that spine and keep it from shifting or irritating so you don't have to live with chronic back pain or symptoms down your leg? That's what we're going to go through.
Sure.
So number 1, avoid painful activities. It's as simple as that.
Yeah, anything that fires it up is not good. I mean, it's just, if you take a hammer, you start hitting your thumb and it hurts, stop hitting your thumb.
Right, the concept is exactly that. So,
you know, the nice thing about it, Brad, though, by the way, is this gets you out of some shopping trips, right?
It does.
Because, I mean, you can only shop so long. I'd be like, I got to get this thing, because when I'm with my wife, you know, my spondy's acting up.
Right,
I got to.
And it's truthful.
It is true. So.
Okay, the other one, walk as tolerated. Bob talks a lot about it, and he emphasizes that more than I do, but I clearly agree with him. Walking is a great exercise for back problems as long as your back tolerates it. In my
Yeah.
situation, 3 to 4 years ago, for a period of 1 to 2 years, I could not walk no more than 3/4 of a mile, and my right leg would start to get tingly and numb down to the foot. So I would never walk that far, just a half mile. Actually, now I just walked 3.5 miles the other day, no problems at all.
You ran it, you said.
Oh, I can walk and run it.
Sure.
I walked with my wife yesterday. I ran it.
Okay.
The day before I walked.
Nice.
Yeah. So walk as tolerated. And here's the big thing. You really need to do some core strengthening and focus. Core strengthening refers to the whole core when we're thinking from a therapist or a trainer point of view, but you need to focus on the abdominals. Okay, not so much back here, but really think about getting these muscles tightened up and strong, because they're going to help support that, minimize or prevent that slippage of the vertebrae in each other. Now remember, if you have a little slippage, you've got some scar tissue that has to heal, and that's not a quick process. So we're going to build muscles up around to support those vertebrae and let that scar tissue build up on each other in the right
You've got
form.
a whole video on strengthening and you like the ball, right?
Oh, I love the ball,
Beauty
Bob.
of the ball.
Right. Yeah, if you go to our playlist, on 2 or 3 of them, I'll show you. I call it my famous 4. There's 4 exercises that I do, and then they only take about 3 minutes, depends on how many you do and how fast you do them. But they're pain-free, they really help the core, and that's been part of my success for sure. Now, the other thing is you want to continue to maintain range of motion. You just don't want to only do flexion exercises. So I will do extension exercises, but I will not overextend, and I won't do it a lot.
Sure.
Okay, and part of my exercise program on the ball is,
A little bit of extension.
yep, I do some extension.
Yeah, you do that one where you do some, well, you can show it real quick.
I'll just show. So you're going to use the ball, and I'm going to extend and work these muscles this much. Now,
Sure.
some people might say you're not extending your back, but you are.
Yes, you are.
As a therapist, you look at
Yeah.
the biomechanics, and we have some extension there. We have strengthening going on. I put my hands here, and then I'll do a
little bit of
Right,
extension.
but I won't go real high. I'm not trying to arch real high. And I'll also put, I think this is critical, you add some rotation so that your back maintains some mobility and rotation. Again, I'm not trying to twist really far.
And definitely pain would be your guide here. If you get any
Right.
pain, stop immediately.
These are completely pain-free for me, and it works well. So maintain some range of motion as much as you can. Now, I'm going to show you some other things.
Some gadgets that help
Gadgets.
you get through the day.
If-
Brad and I always talk about when somebody's in pain, we like to give them tools.
Right.
And some of the tools will work for you and some may not, but these are the ones that have been working for you, right?
In a couple weeks, I've got a project going on. We got some trees that got to get down. I'm calling over some friends. We're going to do some brush piling, cut some trees. I'm going to be wearing this right here. This is a back belt. It works really nice. It pulls up really tight. And so I'm going to wear this not all day long, but when I'm out doing the lifting and stuff, because even that, I got to watch myself. But I can still do it. This gives me a lot of support.
Now, this one was from Braceability.
Yep.
And they've got a lot of nice braces. But what's cool about it is, I can hold on, Brad.
Yeah.
See how that's how it tightens up.
And it's very rigid, and it works well. Easy to tighten up and loosen up. I've worn a lot of braces, and I liked a lot of them, but this one is by far my favorite. Okay, next thing, cold packs. Man, get your cold pack out. If you got a sore back, lay down, and I've done this many times. I use my leg wedge, which I love, and then I put a cold pack right under here. Gonna give me a pillow, Bob?
I'm being a nice guy.
He does care about me. And Bob and I talk about this position a
Yeah.
lot for back pain, and for spondy, it's
really
wonderful.
important, yeah.
As a matter of fact, when I've been flared up because I've done silly things, this is how I go to bed.
Sure.
I'll lay like this, I'll fall asleep, and eventually I
take
take
it
it
out
out.
then?
Yeah. But
Yeah,
I mean, for
that's a good idea.
half hour to an hour, I'm in that really comfortable position, and it's a good way to.
We've got this listed down below in our Amazon products, so
Right.
I'll try to get some of these other ones in there too.
Sure.
We don't have them all in there.
Right.
So
And then if you're an any NSAIDs, ibuprofen, Aleve, whatever you like, just don't overdo that.
right, calm the inflammation.
Right,
down.
I only use that very rarely.
Sure.
Pain meds from the doctor, I've never used any pain meds. I just don't
just
need
not-
to. I've been
sure.
able to easily control it this way. Hot pack. I will use a hot pack now. Only if it's not flared up. If it's flared up and it's sore, I will not. Otherwise, hot pack, I'll use this
Well, you actually use a little more than hot pack. That's infrared.
right, which
Yeah.
goes deep.
Yeah.
Because I want that scar tissue to heal. I want things to get,
So that's Thermatex infrared.
right. And that's
Yeah.
going to go over 2 inches deep, which is
Yeah.
about as far as we need to get.
Normal heat only goes very minimal, a couple millimeters.
Right, yeah, just a hot pack.
yeah.
But you need something like that to get in
goes
there.
deep.
And Bob, this has been one of my favorite
Yeah.
things, is this memory foam lumbar support. And
We've got that listed below.
I've used a lot of lumbar supports over the years, and this clearly is the best one I've ever used for
But
my
let's
back.
make sure we also say I don't like
He
it.
doesn't like it.
I don't like it for my car.
Right.
I like it for my office chair.
Right. So I don't know if this is going to
too-
work for everybody
yeah.
with spondylolisthesis, but it certainly works for me.
Yeah, you've really gone on and on about it. I mean,
Ah.
it's really been a lifesaver.
Favorite. when I first put it in my car, I was like, this is too big. There's no way I'm going to like this.
Sure.
And then you settle into it after a few minutes, and then it's like, oh, I forgot it was there. So that is the recipe right there. I
All
think
right.
the exercises are the biggest thing. Avoid doing silly things, and then use your tools.
I think that was kind of a day in the life of Brad Heineck.
Say no more, Bob. They're really bored now. They're probably all off the channel
All
and
right.
sleeping.
Thanks for watching.